So why is it important for you as a patient that your GP codes information about you on your medical record instead of just typing notes into your record as free text? How can coding protect you as a patient or make it easier to care for you quickly and safely? Here are a few example scenarios from Dr. Neil Paul, a GP in Cheshire. First, let's take the example of recording a hysterectomy. An abdominal hysterectomy can be total or subtotal. Knowing whether a patient has had a total abdominal hysterectomy or a subtotal abdominal hysterectomy is important, as the guidance for care differs, for example, on which type of HRT to prescribe. If I try to prescribe incorrectly, then the clinical system can warn me of this by bringing up an alert, but it can only do this if the correct hysterectomy code was added to the patient's record in the first place. Then let's consider how I can identify patients who are at particular risk of something. We have tools like QRisk, which have algorithms behind them that rely on accurate coding. They can immediately identify groups of high-risk patients or tell me the risk status of an individual patient at the touch of a button. Another example would be that when I add a new diagnosis onto your record, let's say you've just been diagnosed with diabetes, Care Record software can recognise the code that I've added and that it's the first diagnosis of that condition for you. And the system can then present me with templates and other information that makes it quicker and easier for me to run through a standard set of checks, tests, and other actions that we aim to deliver for every newly diagnosed diabetic patient. And more generally, when I look at your medical record on the computer system, I want to be able to see the important things about your health quickly and easily. For example, your allergies, your family history. Was your recent ECG normal? Do you have chronic kidney disease? Because if you do, it might have an effect on the dosage of other drugs that I give you. Are you on steroids? Do you have a history of bleeding? The average GP looks after between 2,000 and 3,000 patients, often dealing with 50 to 100 people on one day. Also, there are thousands of new diseases, drugs, symptoms, etc. each year, and even the best brains can't remember it all. So computers help us pull together links, suggesting possible answers or making us query further. Codes are key to this, giving us a structured, cohesive record. We can also search for patients ourselves, for example, using EMIS or System 1 searches and reports. So we could find patients with a particular history, for example, or a specific medication or a mixture of medication, or patients with important information missing, like a hypertensive patient who hasn't had a blood pressure recorded in the last 12 months, and we can call them in for a check. Searching and reporting also helps us decide which services would be best for our patient population. This has been particularly important recently with the increase in the ARS teams. How might we benefit from implementing first contact physios, for example? Well, let's take a look at how many MSK-related consultations our GPs are having. As searches can be done across multiple practices now, for example with EMIS Enterprise search and reports, it's now possible to provide reports for the larger PCN population too. So we might want some evidence in our PCN relating to patients requiring palliative care or patients with Parkinson's disease, so we as a PCN can create a joint service. And last but not least, we mustn't forget the patient's point of view in all this. A structured coding system helps us make our records clearer for the patient to read, and as there are plans in future to further improve a patient's access to their own record online, it's important that what they read is clear and understandable. So that's a brief overview from a GP's perspective.